that.
Good morning. Thank you, Matthew. Alvaro, if I could have my slides, please. I'll be providing an update on our status regarding COVID-19 pandemic in Marin, and then offer some of the strategies that we're adopting to address what is, I think, one of the challenges that we're facing now as a county as we see increased cases. Next slide, please. This is our daily case count, our cumulative case count since the start of the pandemic. We've had almost 5,000 cases now with 99 deaths, which is a mortality rate countywide of about 2%. Some have noted that the death rate that was announced 2 weeks ago had surpassed 100, and then has now been adjusted to 99. The reason that happens is that as the coroner reviews cases and the medical examiner, or they may be they may be allocated to another county where someone actually was a resident in another county but died in Marin, there's sometimes small changes in the numbers over time. And that's why that happens. It's a matter of just maintaining vigilance around the right numbers as we go. Next, please. This is our epidemic curve since the start. This is the daily number of cases each day. And on the far right there, the most recent numbers, you see a bar that is significantly higher and increased, signifying increased case rates recently. And we'll talk more about that shortly. Next slide, please. This is the number of tests per day in the county. On the left there, you see the total number. We're comfortably over 1,000 tests per day now in Marin. And we had set a goal in June of at least 500 tests per day to correspond with the Johns Hopkins recommendation and CDC recommendation of that number of tests per our population. So we are fortunate to have sufficient testing resources and have made a lot of progress and are looking forward to even more testing capacity coming next week and the week after, as the state has announced they're rolling out a new laboratory that will test 150,000 tests per day statewide for Marin. That will correspond to about 500 new tests we can accomplish for our county daily. Next, please. This is the hospitalizations and ICUs and ICU stays in Marin County currently. 5 in the hospital, 2 in the ICU. Next, please. And all of that boils down to our current tier status being in orange in the California blueprint for a safer economy. That's tier 3. We had opened in the purple tier and tier 1. Have moved successfully through the red tier, are now in the orange tier with a total case rate of 4.1 cases per 100,000 residents, which adjusts based on our high testing rate to 2.6 cases per 100,000 residents, with a 1% positivity rate across the board and a 1.5% positivity in those lowest income health equity quartiles in the county. Next, please. However, I think the most important topic for today is the cause for concern just for more recent increases in cases. Looking back at the average daily cases reported from October 15th through November 4th, that 2-week interval, we were seeing about 9 cases per day. And I obviously, our team reviews each report of each cases that come in on a daily basis. And in the past 4 days, the numbers have been 22, 19, 14, and 24 cases. And that corresponds to, and I've had conversations with other health officers across the region, to a very similar and concerning spike in cases just very recently in early November across the Bay Area. Santa Clara County, San Francisco, Contra Costa, Alameda, and Napa all reported significant spikes in cases. We're also seeing increases statewide, nationally, and even globally. Next, please. So this shows the projection of cases that we might see if that trend of the past 4 days continues. And what it shows is that there on the horizontal lines, you can see what that corresponds to in terms of the tiers, the yellow, the orange, and the red, that we would be in red tier numbers as early as the end of the week if this trend continues. And what that would mean is that if at 2 weeks at that rate, we would be placed by the governor, according to their rules, of 2 weeks in the more restrictive tier into the red tier in terms of the policies, and would have to revert back to those more restrictive policies by order of the state. And obviously that becomes an important organizing goal for our collective work, is to try and maintain our status in the orange tier. Next, please. And this just shows what I was referring to in terms of increases in cases across the state, with a very clear second wave emerging in late October and into early November across the state. Next, please. And we're seeing nationally increase in case rates, especially the upper Midwest have case rates 10 to 20 times higher than they are in California. So as much as we are seeing increases here, the rest of the nation is actually experiencing even more dramatic increases in COVID-19 transmission. Next, please. And then stepping back, even the global picture, there you see the United States on the left, and you can see why travel restrictions against Americans to travel abroad are imposed. We are clearly a global hotspot across the globe, but Europe is also seeing significantly more cases, with more and more restrictive policies being reimposed in most European countries. Next, please. So bring it back to the local picture. We've been able to gain some insights into what's contributing to this latest surge. And I think this is an important topic for us to consider together. On the far right there, you see the blue line corresponds to the number of cases in Marin County among white residents, and the green line corresponds to cases among Latinx residents. And what it shows is, for the first time since the very beginning, really since April, where we've had more cases reported among white residents than Latinx residents over the past week. Next, please. And to flesh that out a bit more, this is a bar graph that shows the percent of cases by race ethnicity. But the vast majority of our cases overall are either among Latinx or white residents. And that proportion has shifted significantly after mid-October. And now we're seeing a lot of progress in the Latinx community, but we're also seeing backsliding and increasing proportion among white residents. Next, please. So this is the new pattern. We're seeing less, as I said, among Latinx residents, essential workers, where the dynamic had been household transmission in more defined geographic areas, the canal area of Centerville, for example. Now we're seeing increased transmission among white residents, which is also happening more widespread geographically across the county. It's not just one area, but it's in bits everywhere. And the main contributors seem to be indoor gatherings and increased mobility as we move into the orange tier. Next, please. One of the key concerns and areas of increased transmission that has been recognized nationally is indoor dining. And it's because there's gatherings indoors across households when people are gathered together in a restaurant indoors. There's limited facial covering because people are obviously dining, eating, and drinking. It's a prolonged period of exposure. It's not uncommon to sit for an hour or more. Food service workers correspondingly have the highest rates of COVID-19 in Marin County, and that's a pattern that's seen across the nation as well. There have been several super spreader events described from restaurants where an individual who may have been infectious at that time, not covering their face because they're eating and drinking, if the ventilation is poor and there's many gathered indoors, one case can lead to, in some descriptions, up to 20 other cases just from one seating at a restaurant. Indoor dining also contributes to greater levels of mobility across the county as people go out to dine. Across the Bay Area, taking that into account, other jurisdictions have taken a more restrictive approach to indoor dining. San Francisco is only allowing 25% indoors, Alameda 25%, Contra Costa and Santa Clara similarly. Sonoma, being in purple, has 0 indoor dining. In Marin County, because we were in the orange tier, we had tied our policies to the orange tier policies and had been at 50% indoor capacity. the recommendation based on recent surges and some of the other patterns we're able to see is for us to align with the Bay Area policies and reduce our indoor dining capacity to 25% as a recommendation beginning now. And if our numbers continue to worsen as a policy that would be invoked locally next Tuesday. As you know, the local health officer has the ability to put in place more restrictive policies than the state. We can't be more relaxed than the state at the local level, but we are able to be more restrictive than the state. And San Francisco, Alameda, Contra Costa, and Santa Clara are also both either an orange or yellow tier, but have chosen a more restrictive regard regarding restaurants for the reasons that I shared. Next, please. So to maintain our status in the orange tier, an option for us is to choose selective red tier policy restrictions, to invoke those prior to the governor who would, if we stay in the red tier on the 24th of November, we would be forced by the state into the red tier and we would have to be in that tier for at least 3 weeks before we could move out. So our hope is that we can actually adjust our policies and our practices so that our rates can stay below that level and that we would avoid having that imposed upon us by the state. Obviously, we want to maintain our testing and contact tracing as a way to maintain our status in the orange tier. And then most importantly, the personal choices people are making in their everyday lives, especially avoiding indoor social gatherings, travel, and limiting activities across the board that involve contact with others. Next, please. And to the point of holiday gatherings, we've just issued a set of recommendations, which is available on the website. We also had a press release yesterday on this. And the key message is that outside is safer. Gathering outside and following the safety guidelines is key. Keeping gatherings small, so limiting gatherings to more than 3 households total, according to that's legislated currently and the state guidelines for orange tier. Keeping gatherings short. The longer the interval, especially if there's close contact, the higher the risk of exposure and infection. So limiting gatherings to no more than 2 hours. And then keeping the gathering stable. You know, as people get invited to different holiday gatherings, it's possible that you might participate in one group on one day and another on the next and another on the next. And that's simply not safe. People need to start making choices about their holiday pod and not to participate in multiple gatherings with different households. Next, please. We also issued travel recommendations in concert with the other Bay Area health officers yesterday. Obviously, the top recommendation is to avoid travel during the holidays. We're seeing upticks in cases already, and really the bulk of holiday travel and holiday gatherings hasn't even begun yet. So there's a significant concern that if people travel, especially if they travel outside of the area to where transmission rates are higher, as I indicated, in most parts of the United States, rates are even higher than they are in California, more likelihood of being exposed and bringing the virus home. So it's recommended that if you must travel, to quarantine for 14 days after you return, especially if activities you've engaged in or you're aware of any experience that put you at higher risk of getting COVID-19. And then also taking steps to reduce risk, wearing facial covering, physical distancing, sanitizing your hands frequently, getting tested before and after travel is something also to consider. If anyone has traveled outside of the Bay Area, you may recognize that it's not uncommon for people elsewhere to have less rigorous approach to this. And in the Bay Area, we've created a bubble of best practices in some ways. As much as we know we could do better, adherence to facial covering is higher in the Bay Area than it is in other areas. And we want to make sure that you take those practices with you. The things that we see as important and normative in our area need to be those behaviors that you would adopt, even if others around you are not doing those things if you travel outside. Next, please. And then briefly, I'll touch on the COVID-19 vaccine. Very exciting news yesterday. The Pfizer vaccine is completing the phase 3 clinical trials, indications that it's potentially up to 90% effective, which is, I think, exceeds most people's expectations of how that vaccine would perform. possible December would be the first doses coming our way. It is unfortunately requires ultra cold storage. Compared to the other vaccine, it requires -70°C, which is not a standard temperature for hospitals and others to be storing vaccines. So there's going to need to be some increased infrastructure around refrigeration for that, and we're working with our hospitals on that. The high-risk essential healthcare workforce is the first tier for that, and we've solicited from all of our hospitals and healthcare providers those that would fit into those categories, and we have a few thousand people identified as probably that first tier when the vaccine arrives. The distribution plan is from the federal to the state and then state to the county. We're working with our healthcare partners, meeting regularly on our distribution plan. It's looking like after the first doses end up being for that first tier, in the springtime, there'll be much more available, and that would when we would be doing distribution for the general population. Next, please. And remember, always, still, it's not too late to get your flu shot. This is the right time of year to do it. If you haven't, please do. We're really pleased. We're hearing from Kaiser and other major healthcare providers in our community that flu shot uptake is at its all-time high. And that's a sign that people are taking this seriously and helping us avoid the twindemic that might otherwise occur if we're vulnerable to both COVID-19 and influenza. Next, please. So in summary, we are still in tier 3 orange, but spikes in cases regionally and across the state are threatening our progress. Selective policies can stabilize rates and maintain our tier status. We're now recommending restaurants, for example, reduce their indoor capacity to 25%. We'll be following the numbers closely. Holiday gatherings and holiday travel are not safe. We've heard some promising vaccine news with the 90% efficacy. And remember to get your flu shot. Thank you.